What's up, beautiful people? Another day, another study. We talk a lot about IBS on the channel because it's something that I have. I started off with IBS-C and used to have horrible pains, and then it turned to mixed IBS, and now whenever it flares up, it's IBS-D. And I was able to control a lot of that through lifestyle changes, most of which was dietary. And so this study was looking at two different dietary approaches. One is the low-FODMAP diet, which is a very restrictive diet. And usually you do that for 4, 8, maybe 12 weeks. And then you expand that, add things back one at a time and see how people react versus the diet that gets studied the most in the literature. And that's the Mediterranean diet. And there's preliminary evidence showing Mediterranean diet may be beneficial for people with irritable bowel syndrome, maybe by modulating the gut microbiome, by reducing gut inflammation, enhancing gut barrier function, or maybe by helping with the function of the gut as far as motility and emptying and so forth. So this is a pilot study, a feasibility study, looking at comparing a Mediterranean diet with a low FODMAP diet. And the primary thing was on abdominal pain, but they also looked at some secondary outcomes like bloating, symptom improvement, and so forth. It was a 4-week study. At the end of the 4 weeks, depending on which type of analysis they did, the intention to treat or the per protocol, the difference is the intention to treat leaves in everyone, even if they dropped out. Per protocols, only people that finished. The low FODMAP group saw a better improvement in abdominal pain, but it wasn't statistically significant. It also saw better improvements in IBS scores, but it wasn't statistically significant. Same thing with abdominal discomfort, bloating, and anxiety decreases, also increases in specific quality of life scores for irritable bowel. But again, none of these were statistically significant, which is not surprising because this is a pilot study. Only 20 people managed to complete the study, so 10 in each arm. However, it was shown to be feasible. Average compliance was around 94% for both arms, and only 2 people dropped out, one for constipation in the LFT group, another for abdominal pain in the Mediterranean diet group. So this is really interesting. I would love to see a longer randomized controlled trial here. In fact, one of the things I've done with clients is start them on a low FODMAP for 8 to 12 weeks and then actually transition them slowly over to like a Mediterranean type plan. Love to see a study on that as well.